everyone, welcome to my YouTube channel. This is the best YouTube channel where you get to learn medicine at the comfort of your living room. Kindly, if this is the very first time that you are coming across this channel, I request you to subscribe to, and you can like, also comment, and you can share the video, and also help me share the link so that we can reach a wide range of people. This channel basically deals with women health, and mostly I update the cases that concerns our women. Today I will be talking about a very common condition that is affecting the most reproductive age females, and something that has continued to affect women, especially when it comes to issues with getting pregnant. Today I will be talking about a condition that we refer to as endometriosis. And in this topic, first of all, as usual, I will give the definition of endometriosis, on what we mean by endometriosis. I will talk about the signs and symptoms of endometriosis. I will talk about the causes. Still, I will talk about the diagnosis technique, or the ways that you can use to diagnose that you have endometriosis. I will talk about the complications, or the risks that are there when you have endometriosis, and then I will talk about the treatment. Okay, so all these are the subtopics that I will try as much as possible to handle concerning this endometriosis topic. So basically, what we mean by endometriosis, this is a condition, and even before I proceed, this endometriosis is coming from the word endometrium. It's coming from the word endometrium, and endometrium, this one is a layer that is found in the uterus. So this being the uterus, okay, this being the uterus, and this is being the cervix here. The uterus is made up of 3 layers. So this is the inner layer, we have the middle layer, and we have the outer layer. So those are the layers that are there in the uterus. So the inside layer, this now layer inside here, this is the layer that we refer to as the endometrium. Okay, so what happens by endometriosis, or this endometriosis itself, it is a condition, or it is a disease whereby the tissue that lies inside here, because there must be a tissue. Now this layer inside here, it gets up and grows outside the endometrium. Okay, so because we have a layer inside here, so when you have endometriosis, this layer that normally grows on the inner side goes and grows on the outer side of the uterus. So, or in other words, when the inner layer of the endometrium is found outside, that is what we refer to as endometriosis. So anytime when you go into the hospital and maybe the doctor says that you are suffering from endometriosis, what it simply means, it means that the inner layer that is supposed to be inside is all has grown on the outer side. So that is basically what we mean by endometriosis. So from there, now we are going on to talk about the signs and the symptoms of endometriosis. Now one of the signs, and I will be quick, The signs of endometriosis are many, but I will try to talk about the most common signs that are there. The sign number one that people complain of, the sign number one, it's whereby they have excessive pain, they experience excessive pain during their menses. So you end up realizing that when you are menstruating, you are experiencing a lot of pain more than other days. Like what we mean by excessive pain during your menses, this is the pain that in most cases makes you not to be able to perform your duties normally. Another second sign that we have in endometriosis, this is whereby you have excessive menstrual flow or bleeding. Okay, so in this case, what we're talking about excessive menstrual flow, this is whereby normally in your menses you are not supposed to bleed too much, and medically we say any bleeding that exceeds 4 pants that are fully soaked. So if it happens you are experiencing your menses and you are using more than 4 pants that are full and fully soaked, so that is what we term to as excessive menstrual flow. Another sign another symptom of endometriosis, it's whereby you experience pain during urination. There is pain when you are urinating and also when defecating. So what we mean by defecating, this is to poop, or in other words the long call. So and mostly when you are on your menses. So if again you ever experience, or anytime that you are going to urinate or to defecate, that is pooping, and you experience a lot of pain, and that pain is mostly there during your menstruation, that one is also another sign of endometriosis. Another sign of endometriosis, it's whereby you have painful sex. Okay, so if at all every time when you have sex there is a lot of pain, then that one means that it's also another sign of endometriosis. Okay. Any other sign, another sign of endometriosis that is commonly there, it's when you have the flank pains or the lower abdominal pains. So when you have these lower abdominal pains, it's also another sign of endometriosis. And also we have issues with the problems with conceiving. Okay, problems with conceiving, or problems with getting pregnant. So these are the most common signs and the symptoms of endometriosis. But the most one that we'll experience is whereby you have painful menses, where you will have excessive menstrual flow, where you will have pain when you are urinating, or also when you are defecating, and especially during your periods, and where you also have painful sex, and also the problems with getting pregnant. So those are the most common, and those are the basic signs and symptoms of endometriosis. So anytime when you experience any of these signs, you better consider to go and have checked whether you have endometriosis. So after talking about the signs and the symptoms, I want us now talk about the causes of endometriosis. Okay, so the causes of endometriosis, what we talking about the causes, first of all let me say that currently there is no proved cause of endometriosis. So in most cases these endometriosis, the main cause has not yet been established, but there is one major belief that might, or that may trigger this endometriosis to occur, and that is something that we refer to as retrograde menstruation. So I will explain to you what we mean by retrograde menstruation. So this being the ovaries here, and this one being the uterus, this one being the ovaries. So this one, it's not blocked, and also that one. Okay, so what happens, or the pathophysiology of menstruation, every month the egg here, the ovary here releases some mature egg that comes to the fallopian tubes to wait for fertilization. So if there is no after that, this egg moves down here and comes and attaches on the walls of the uterus. So if there is no fertilization that will take place, all this layer of the endometrium sheds off and moves out through the cervix into the vagina as menses. So that's normally how happens for you to experience your menses. Now, what we are talking about retrograde menstruation, normally the menses are supposed to move out through the cervix and into the vagina outside. So in retrograde menstruation, this is whereby instead of the menses moving out through the cervix downwards, the menstruation flows back. Okay, so when this menstruation flows back, then it ends up getting outside, and it falls into the abdomen. It might even go back through the fallopian tube, and then it pours down into the abdomen. So anytime when you are not experiencing your menses, the menses, instead of your menses coming down through the cervix into the vagina, it flows back, and then it drains into the abdomen or the peritoneum. So that is what we mean by retrograde menstruation. So if these menses continues to flow back, they will come and attach themselves here, causing the growth of the endometrial layer on the outer side of the uterus. So that one is one cause that is believed is one cause of endometriosis. Another cause it's one by it can be inherited. So in most cases, if maybe your mother or your sister or your immediate relative has ever suffered from endometriosis, you are also likely to suffer from this endometriosis, and it continues to worsen with the generations and the way it's being transferred from one person to another. But in this case, the most cause that is believed to be the main cause of endometriosis is this thing that I've talked about, retrograde menstruation. Okay, so after now the causes, we will talk about after now we have talked about the symptoms and the causes of endometriosis. Allow me to speak about the diagnosis, or how can you diagnose endometriosis. Endometriosis is easy to diagnose. Number one, we can diagnose endometriosis via pelvic exam. What we mean by pelvic exam, this is whereby you can go lie on your back, and then the doctor will palpate your abdomen, and in this case the doctor in most cases is able to feel some mass behind your uterus, but this one goes with the time as you get the expertise to feel the masses. But the most approved diagnostic techniques that are basically used, we have the ultrasound. So you can have an ultrasound to diagnose them. You can also have the CT scan of the abdomen, and we can also have the MRI. Okay, the MRI, this is simply represent for magnetic resonance in imaging. Okay, so you can also have the MRI and the abdominal computerized tomography, or the CT scan. These are the these are some of the diagnostic techniques that can be used to rule out whether you are suffering from endometriosis. But since most of the healthy facilities does not have all these CT scan and the MRI, the bottom line, or the basic diagnostic technique that is mostly used in most cases is the ultrasound. So with an ultrasound, you can easily get diagnosed of whether you have endometriosis or you have any other problem. So after we have talked about the imaging techniques, allow me now to speak about the complications. What we mean by complications are in other words, what are the worst side? Okay, what are the worst side of this endometriosis? Or if this endometriosis majorly it's not treated, what are the common complications that are likely to arise from it? So one of the complications we have infertility, and I will get back to explain how infertility causes, how endometriosis causes infertility. Another complication is whereby you can have something that we refer to adenocarcinoma, or the endometriosis associated cancer. So this is the cancer of the endometrium. This is the cancer of the endometrium. Okay, so it can lead to cancer, but most basically a cancer that is associated with the endometriosis. So as a result, you can even suffer from maybe depression. So these are some of the other complications that may result to it. You may suffer from anemia because of excessive bleeding, and also you can even suffer from chronic abdominal pains. Okay, you can suffer from chronic abdominal pains in most cases. So these are some of the basic, but most cases, or the most common complications, are the first three, where you can have infertility, where you can have the cancer of the endometrium, where you can have anemia. So those are the most common complications that are likely to arise when you are suffering from endometriosis. So I said I will explain to you how this endometriosis ends up causing infertility. Remember, we said this being the ovaries here, and this being the uterus here. When this layer continues to grow, in most cases, when it continues to grow, it might end up affecting even the tubes. Number one, it may cause them blocked tubes. It may make the tubes to be blocked. Number two, if it happens, it attaches around the ovaries here, it will make the ovary to fail to produce the ova. Okay, so what happens when this tissue ends up covering the outer signs of the ovary? It may make it hard for the ovum to be produced. Okay, so it can cause these blocked tubes. It can make the egg to fail to be produced. At the same time, it can also come when it becomes so big. It also interferes with the hormones in your body. It also interferes with your hormones, and in those cases, it can lead to infertility. Okay, after we have talked about the complications, allow me talk about the treatment that we have when we are talking about endometriosis. Okay, so the treatment of endometriosis, the treatment number one, it's whereby we give you just the pain relievers. So this is whereby we can give you some drugs like maybe brufen to ease the pain. We can give you drugs like meloxicam. We can even give medications like piroxicam. In most cases, we give the NSAIDs, or the non-steroidal anti-inflammatory drugs. So these are the most of the common drugs that we give in this case to relieve the pain. So another treatment, we can decide to treat you with hormonal therapy. So in most cases, we treat you with hormonal therapy, number one, to ease the symptoms, and number two, to make sure that at least we are altering with the hormones in the body, so that this condition will not keep on being severe. So in most cases, some of the hormones that we give, we can decide to give the COC, or the combined oral contraceptives. We also give some drugs that we refer to as gonadotropin releasing hormone. An example of this, we can decide to give you leuprolide injection or even the horals. We can also decide to give you another drug. It's this one hormone that we refer to as danazol. We can also give this kind of a drug, but in most cases we just manage it with hormones, depending on your presentation and depending on the complaints that are there. We also have another basic treatment where we can have surgery, okay, where you can have an operation done, and in this case we try to remove the lesions, and we try to remove all the adhesions that are around the uterus, all the adhesions that are around the ovaries, and all the adhesions that might also be blocking the tubes. I will let you know that some of these treatment, in most cases, this treatment may fail to make it possible for you to conceive. And in most cases, if it happens you may fail to conceive, we can advise mostly on something that we refer to as IUI, or intrauterine, intrauterine. The I, this one represents for intra, U, it's uterine, and other I is insemination. So this is whereby we pick the sperms of your partner and introduce them into your abdomen directly. So these are some of the treatment that we can give, because remember, this endometriosis does not have any cure. So there is no permanent cure for this endometriosis. Okay, so what we basically do, we try to give you the treatment to make sure that we are easing the pain, and to make sure that you are easing the symptoms that you are having. So maybe if you present with a lot of pain, that is when we give you painkillers. If you present with a lot of bleeding, we try to stop that bleeding. We can decide to give you an injection that mostly that is, we term it as a tranexamic acid injection, or we cannot even decide to give you an oral medication to make to stop the bleeding. If maybe you are anemic, after now you have bled for so long, and you end up getting anemia, we also give you some medications to boost your hemoglobin levels. And if you are trying to get pregnant, in most cases we can try as much as possible to manage this, but if it happens it fails, then we end up requesting you to have an intrauterine insemination done. So if in most cases, if you are past the age of where you want to get pregnant, in most cases we can perform something that we refer to as hysterectomy. So this hysterectomy is the complete removal. This is the complete removal of the uterus. So we can just remove your uterus completely together with the cervix, and we can also have something that we refer to as oophorectomy. Oophorectomy, this one is the removal of the ovaries. So we can decide to either have oophorectomy, hysterectomy. Any surgical procedure can be done to make sure that we are easing you from all these issues about endometriosis. But in most cases, kindly remember of the signs and the symptoms that are associated with endometriosis, so that anytime you have any of the signs and symptoms, you can remember to go have an ultrasound done. You can request it by yourself. If you have endometriosis, then you can go see the gynecologist around and you will be assisted. So that marks the end of our topic today, and I kindly request, if this is the very first time when you are coming across this channel, I believe it is helpful and I believe it will keep on helping you. So you can kindly subscribe to my YouTube channel, you like, you comment, and you also share. If you have any other question that you want us to discuss, or you have any topic that you feel we should discuss about here, you can comment it there, and then I will go through it and I will cover it right here again into this YouTube.